Hello, my name is Oscar Dadashian. You're receiving this video because you're interested in having dental implants at one of our practices. The information you're about to hear is the sort of information me and my colleagues will give you during your consultation at our practice. I would definitely recommend you to still come in for your free consultation so that we can go through all the information, have a look at your specific case and give you more advice of what's possible and what's not possible. I'm going to talk to you about what options you have to dental implants and the advantages and disadvantages. The purpose of this video is that when you come back to our surgery for your consultation, you have a good idea of what dental implants are, and we can have a much more productive discussion, and hopefully you will have more questions for me. Looking forward to seeing you.
There are four main options when you have missing teeth. You can have them replaced by dentures, by a dental bridge, by dental implants, or lastly, you can just leave the gap. Dentures. There are two main types of denture. The first type is plastic or acrylic. These can replace one tooth, multiple teeth, or the whole arch. The second type is a chrome-based denture. Chrome-based dentures are a bit neater and smaller. However, they are also a lot firmer in your mouth. Both types of denture are removable and require removal at night. They will require cleaning and then putting back in the mouth in the morning. The main advantage with denture is that they are relatively easy to make. Also, if you lose more teeth, it's relatively easy to add additional teeth. The disadvantage to dentures is that these are removable appliances, so they are not firm. You can get food stuck underneath them. You need to take them out for cleaning and then put them back on. But the main disadvantage of a denture is that they do not prevent you from losing bone. The main function of your jawbone is to support teeth. When there are no teeth, the jawbone will be lost. Dentures do not stimulate your jawbone, hence they will not help preserve your vital jawbone. The second option is a dental bridge. There are two types of bridges. Firstly, a resin retained bridge. These sort of bridges are minimally invasive. Appearance-wise, it looks like a tooth. This imitation tooth is held in place with one or two wings that are glued to the adjacent teeth. This is so you cannot see the wings that hold the tooth in place. The advantage with this sort of restoration is that they are minimally invasive, as we are not cutting down teeth. They are also very nice and firm, and you do not need to take them out to clean them like a denture. The disadvantage with this sort of bridge is, aesthetically, the wing behind the adjacent teeth could make the adjacent teeth look grey. Hence, at times, they are not aesthetically pleasing. Typically, this option only lasts for around 5 to 10 years. The second option is a conventional bridge. A conventional bridge means that we need to cut down the adjacent teeth to the gap. The teeth that have been cut down have crowns placed on them, and the third crown will be attached to these crowns, covering the gap. The biggest advantage with this restoration is that it only takes a couple of weeks from start to finish. The biggest disadvantage is that we're cutting the adjacent healthy teeth down. In the long run, should anything go wrong with the bridge, it may also result in the need to remove those adjacent teeth. So you may end up losing more teeth than was the original problem. Hence, you are left with a bigger problem to resolve. With both bridges, we have the same issue as was presented with the dentures. The fact remains that both dentures and bridges do not replace the teeth, hence you will lose jawbone. Bridges, just like dentures, do not prevent the loss of bone. So after time, you will start to see an unsightly gap appear below the bridge as the bone resorbs. Option number 3 is a dental implant. A dental implant is a titanium screw that is put into the bone, and on top of that titanium screw we put something called an abutment. On top of that abutment fits the crown. The biggest advantage with dental implants is the fact that we are putting a titanium screw into the bone, and that bone is then preserved. You do not lose any bone around the area, unlike you would with a denture, a bridge, or if you did nothing. A dental implant restoration is freestanding, so we are not involving any other tooth like we would with a bridge. Dental implants look and feel like your own natural teeth and function in much the same way, unlike any other option. The only disadvantage with this sort of restoration is that it takes between 4 and 6 months from beginning to end for the whole procedure to be finalised. The main consequence of doing nothing is that we are going to lose bone width. As mentioned before, the main function of the jawbone is to support a tooth, and when there is no tooth, that bone will disappear. Therefore, options such as a denture or a bridge are not going to stimulate and preserve the bone. The only option is placing an implant. An implant will exert pressure onto the bone and stimulate and preserve the bone. By doing nothing, you will not only lose the bone in a horizontal dimension, as shown here on the photograph, you will also lose bone in the vertical dimension. When you lose bone in the vertical dimension, it will cause cosmetic issues with any sort of restoration. That means the tooth that needs replacing is going to look longer, and therefore the gum lines are not going to be harmonious. In cases where bone loss has already happened, we can still repair the bone via bone augmentation, but your original bone is the best bone. The other consequence of doing nothing is that your teeth are going to move. The adjacent teeth to the gap are going to drift inwards towards the gap. Also, the opposing tooth is going to over-erupt. Along with this, the teeth next to the opposing tooth are going to drift, impacting your bite. So, let's talk about the implant procedure itself. The implant procedure is done in several stages. Firstly, we painlessly place your implant where your tooth used to be. We then need to allow 2 to 3 months for the area to fully heal, and we want to do that without putting any tooth on top, so the implant can heal into the bone without any movement. This is like if you fall down and hurt your arm. The last thing you want to do is go to the gym and start lifting weights. So you allow time for it to heal before you start using it. After this initial healing, we are going to place an abutment on top of the implant. The abutment, which is called a healing abutment, is going to create a beautiful area around the implant. That area will then give us an emergence profile which we are going to use to restore your implant. After a few weeks of having the healing abutment in place, we will place your final abutment in and take impressions or a scan of the area. Your final crown will go on top of that abutment. This final restoration stage takes a couple of weeks, and the whole process from the time we place the implant until you have a tooth on top of that implant typically takes 4 months. By now, you're probably wondering how uncomfortable is this procedure. Your teeth are the second organ in your body with the most amount of nerves. These nerves go directly into your teeth via the roots, but once you take a tooth out or lose a tooth, the nerves disappear. Therefore, the bone itself does not have many nerves, meaning that when we place an implant inside the bone, in the majority of the cases, it is painless. For example, typically when we extract a patient's tooth, they need to take painkillers for around 2 to 5 days, and often 6 to 7 individuals out of 10 need to take painkillers. However, only 1 out of 10 patients need to take painkillers in the case of a dental implant placement. Because your bone hasn't got many nerves, the most uncomfortable part of the dental implant treatment is the gum. We need to manipulate the gum in order to place the implant. Sometimes this area can get sore. However, this can be likened to when you cut your skin. When you cut your skin, for a period afterwards, every time you touch that cut, you are aware that something has happened, but you very rarely need to take painkillers. Dental implants enjoy a high success rate. The success rate is above 95%, and in average, implants last for over 15 to 20 years. Can anyone have dental implants? Dental implants are suitable for most adults, considering that they are in good general health and they have healthy gums. Dental implants are not suitable for children or anyone aged under 18 years of age. We may not recommend it for people who smoke more than 5 cigarettes a day and cannot commit to reduce or stop. Patients who have uncontrolled diabetes, bone disorders, bleeding disorders, or who misuse drugs and alcohol. How much do dental implants cost? The total investment depends on how many implants you will need and the complexity of your case. It is true, the investment is often more than other options, but dental implants are likely to last much longer than cheaper alternatives. Therefore, we recommend that you come in for a free consultation so we can assess your case on an individual level. During your free consultation, we will give you an estimate so you know exactly the total investment. I would like to let you know that we have a 0% finance in place for over 36 months. This has helped many of our wonderful patients make this investment in themselves. Why would you choose us for dental implants? We're very lucky that we have a dedicated multidisciplinary team that is led by Dr. Oscar Dadashian. Oscar has been placing implants since 2009 and has completed his master's degree in dental implantology. Oscar works very closely with our specialist periodontist. Awa, our gum specialist, helps get patients ready for dental implants. We often use the help of our periodontist to make sure that there are no diseases in the mouth and it is a nice healthy place for your dental implant. We also have our in-house dental technician for all restorations. This in-house ability allows us to make any changes necessary. For example, changing the colour of your final restoration. We have the ability to get patients to come in and spend a couple of hours with us in the surgery while our in-house technician sorts the colour and makes sure that every issue is fixed. We have multiple other colleagues that work alongside us to assist us in placing dental implants. We have our hygienist team who help us in maintaining these implants and a fantastic supporting team to help us achieve your and our goals. I hope you have found this presentation useful and I very much look forward to welcoming you at the practice very soon.